There is a virus circulating right now that most people have never heard of, a virus that can kill a healthy adult within days of the first symptoms appearing, and a virus that is carried by one of the most common animals on the planet, the ordinary mouse. I am talking about Hantavirus, and if you live anywhere near rodents, if you have a garage, a shed, a cabin, a barn, or even an older home with gaps in the walls, you need to understand exactly what this virus is, how it spreads, and why the warning signs are so easy to miss until it is too late. Hantavirus is not new. It has been recognized since the 1990s, when a mysterious outbreak in the Four Corners region of the southwestern United States killed several young, previously healthy Navajo people within days. The culprit was eventually identified as a novel strain of Hantavirus, now called sin nombre virus, carried by deer mice. Since then, hundreds of cases have been confirmed across the United States, with a fatality rate that should terrify anyone who hears it, approximately 36%. More than 1 in 3 people who develop hantavirus pulmonary syndrome, the severe form of the disease, will die from it. There is no vaccine, no antiviral treatment, and no cure. The only defense is prevention and early recognition. Let me explain exactly how hantavirus spreads, because this is crucial information that most people get wrong. You do not catch hantavirus from a mouse bite. You do not catch it from touching a mouse. The primary route of infection is through breathing in tiny, viral particles that become airborne when dried rodent urine, droppings, or nesting material is disturbed. Think about what that means practically. Sweeping out a garage where mice have been living, cleaning out a storage shed in the spring, opening a cabin that has been closed for the winter, raking leaves near a woodpile where mice nest, moving boxes in an attic or basement. Any of these common activities can launch invisible, viral particles into the air, where you inhale them deep into your lungs without ever knowing it happened. The virus can also be transmitted through direct contact with rodent urine, or droppings if you touch contaminated surfaces, and then touch your face, mouth, or eyes. And in rare cases, a bite from an infected rodent can transmit the virus directly, but the overwhelming majority of cases come from inhalation. Breathing in dust contaminated with viral particles from dried rodent excreta. Now here are the 7 warning signs that everyone needs to know. Because the early symptoms of hantavirus infection are deceptively similar to common illnesses like the flu, which is exactly why so many cases are diagnosed too late. Warning sign number 1 is the sudden onset of high fever. Hantavirus infection typically begins 1 to 8 weeks after exposure with a fever that comes on rapidly, often reaching 101 to 104 degrees Fahrenheit. This fever is persistent and does not respond well to over-the-counter fever reducers. Many people dismiss it as the flu or a bad cold, especially during fall and winter months when respiratory illnesses are common. But unlike the seasonal flu, which usually develops gradually over a day or two, the hantavirus fever often strikes suddenly, going from feeling fine to burning up within hours. Warning sign number 2 is severe muscle aches, particularly in the large muscle groups. Patients consistently describe intense pain in the thighs, hips, back, and shoulders. These are not ordinary aches and pains. They are deep, relentless muscle pains that make it difficult to walk, climb stairs, or even get out of bed. Some patients describe it as feeling like they were beaten with a baseball bat. The pain is caused by the virus attacking the endothelial cells, the cells lining blood vessels throughout the body, which triggers widespread inflammation in muscle tissue. Warning sign number 3 is extreme fatigue and weakness. This is not ordinary tiredness. Patients describe an overwhelming exhaustion that makes even simple activities feel impossible. This fatigue is out of proportion to any physical activity and does not improve with rest. It reflects the body's immune system mounting a massive response against the virus, diverting energy from normal functions to fight the infection. Warning sign number 4 is gastrointestinal symptoms, which include nausea, vomiting, diarrhea, and abdominal pain. These symptoms are present in roughly half of hantavirus cases and are another reason the disease is frequently misdiagnosed. A patient with fever, muscle aches, and vomiting might be told they have gastroenteritis, food poisoning, or a stomach virus. But if these gastrointestinal symptoms appear alongside severe fatigue and muscle pain, and especially if the patient has had recent exposure to areas where rodents are present, hantavirus should be considered immediately. Warning sign number 5 is the headache. Hantavirus characteristically causes a severe headache that many patients describe as the worst headache of their lives. It is often accompanied by dizziness and sometimes by visual disturbances. The headache is caused by the virus's effects on blood vessel walls, including those in the brain, and the resulting changes in fluid balance and blood pressure. Warning sign number 6 is the one that signals you are entering the danger zone: shortness of breath. This is the hallmark symptom that distinguishes hantavirus from the flu and signals the transition from the early phase of illness to hantavirus pulmonary syndrome. The virus attacks the endothelial cells lining the tiny blood vessels in the lungs, causing them to become leaky. Fluid pours out of the bloodstream into the air sacs of the lungs, a process called pulmonary edema. The lungs literally begin filling with fluid, and the patient's ability to get oxygen drops rapidly. Shortness of breath that develops 4 to 10 days after the onset of fever, muscle aches, and fatigue is a medical emergency. Patients can deteriorate from mild breathlessness to respiratory failure, requiring mechanical ventilation within 24 to 48 hours. Warning sign number 7 is a rapid heart rate, sometimes accompanied by a drop in blood pressure. As the lungs fill with fluid and oxygen levels fall, the heart beats faster to try to compensate. The blood pressure may drop as fluid leaks out of the bloodstream into the tissues. This combination, rapid heart rate, falling blood pressure, and worsening shortness of breath, indicates that hantavirus pulmonary syndrome is progressing, and the patient needs intensive care immediately. The critical window for survival is the transition between the early flu-like phase and the onset of respiratory symptoms. If a patient can be identified and moved to intensive care before the lungs are severely compromised, the survival rate improves dramatically. Supportive care, including supplemental oxygen, mechanical ventilation, and in severe cases, extracorporeal membrane oxygenation, which functions as an external lung machine, can carry patients through the worst of the illness, while their immune system fights the virus. But once the lungs are severely flooded, the mortality rate climbs steeply. So, who is at risk? The truth is that anyone who comes into contact with rodent droppings, urine, or nesting material can be exposed. But certain groups face particularly high risk. People who live in rural areas where deer mice are common. People who work in agriculture, forestry, or construction. People who clean out sheds, barns, garages, or cabins that have been closed for extended periods. Campers and hikers who sleep in shelters or cabins. Anyone who stores food in areas accessible to rodents. And homeowners who discover mouse infestations and attempt to clean them up without proper precautions. In the United States, the deer mouse is the primary carrier of sin nombre virus, the strain responsible for most hantavirus pulmonary syndrome cases. But other rodent species carry different hantavirus strains in different parts of the world. In Asia and Europe, bank voles, striped field mice, and Norway rats carry strains that cause hemorrhagic fever with renal syndrome, a different but also potentially fatal form of hantavirus disease. The common denominator is rodents, and rodents are everywhere. Prevention is the most important tool you have, because once infection occurs, there is no specific treatment. Here is what you need to do. First, seal your home. Close gaps and holes in walls, foundations, doors and windows where rodents can enter. Mice can squeeze through openings as small as 1/4 of an inch, roughly the diameter of a pencil. Use steel wool, cork or metal flashing to seal these entry points. Second, eliminate food sources. Store all food, including pet food, in sealed containers. Keep garbage in tightly closed bins. Clean up spilled food and crumbs immediately. Third, set traps around the perimeter of your home and in areas where you have seen signs of rodent activity. Snap traps are effective and avoid the problems associated with poison bait, which can leave dead rodents in inaccessible locations where they decompose. Fourth, and this is critically important, never dry sweep or vacuum areas contaminated with rodent droppings. Sweeping and vacuuming launch viral particles into the air, exactly the exposure route that causes infection. Instead, put on rubber gloves and a properly fitted N95 respirator mask. Ventilate the area by opening doors and windows for at least 30 minutes before you begin cleaning. Spray the contaminated area with a mixture of 1 part bleach to 10 parts water and let it soak for at least 5 minutes. This kills the virus, Then wipe out the droppings and contaminated material with damp paper towels and dispose of them in sealed plastic bags. When you are finished, remove your gloves, wash your hands thoroughly with soap and water, and then wash your clothes. Fifth, if you are opening a cabin, shed, or storage area that has been closed for months, assume rodents have been inside. Open all doors and windows and air it out for at least 30 minutes before entering. Look for signs of rodent activity: droppings, urine stains, shredded paper or fabric, gnaw marks or musty odours. If you find evidence of rodents, follow the wet cleaning protocol I just described before spending any time inside. I want to emphasise something that many people underestimate. The virus can remain infectious in dried rodent excreta for days to weeks under favourable conditions. This means that old droppings are not safe droppings. Even if the mice are gone, the virus they left behind can still infect you. This is why the wet cleaning method is so important. Moisture prevents the viral particles from becoming airborne. If you develop a sudden high fever with severe muscle aches within 1 to 8 weeks of any potential rodent exposure, do not dismiss it as the flu. Tell your doctor explicitly about the exposure. Mention cleaning a shed, finding mouse droppings, staying in a cabin, or any other contact with rodent-contaminated areas. This information can trigger the diagnostic process that leads to hantavirus testing and early intensive care, which is the difference between life and death for many patients. There is no commercially available vaccine for hantavirus, although several are in various stages of research and development. Until a vaccine exists, prevention through rodent control and safe cleaning practices remains the only reliable protection. Let me also address a common question. Can hantavirus spread from person to person? In the case of sin nombre virus, the strain predominant in North America, person-to-person transmission has not been documented. You cannot catch it from an infected family member, co-worker, or hospital patient through casual contact, coughing or sneezing. However, a strain found in South America, called Andes virus, has been documented to spread between people in some cases. This is an important distinction for anyone travelling to South America, but for most people in North America and Europe, the risk is exclusively from rodent exposure. The danger of hantavirus lies in its ability to hide in plain sight. The symptoms mimic common illnesses. The exposure happens during routine activities. The virus is carried by animals that live in and around human homes and workplaces, but the consequences can be devastating and rapid. By knowing the 7 warning signs and taking proper precautions around rodent-contaminated environments, you dramatically reduce your risk. If this information could save someone's life, and it genuinely could, please share this with everyone you know, especially anyone who lives in a rural area, works outdoors, or is planning to clean out a storage space, cabin, or garage this season. Subscribe to this channel for more critical health information, and leave a comment below with your questions. I'm here to help you protect yourself and your family. Stay safe out there. I want to discuss an aspect of hantavirus that many people overlook: the emotional and psychological impact on survivors. Hantavirus pulmonary syndrome is a traumatic medical experience. Patients who survive often spend days or weeks in intensive care units, many on mechanical ventilators, fighting for every breath. The recovery period can extend for months, with persistent fatigue, shortness of breath on exertion, and reduced exercise tolerance. Some survivors report lasting psychological effects, including post-traumatic stress disorder, anxiety about returning to environments where they were exposed, and depression related to the prolonged recovery process. Support from family, friends, and mental health professionals is an important part of the recovery journey. I also want to address the geographic scope of hantavirus risk, because many people mistakenly believe this is only a problem in the American Southwest. While the original 1993 outbreak occurred in the Four Corners region of New Mexico, Arizona, Colorado, and Utah, cases of hantavirus pulmonary syndrome have been confirmed in more than 30 states across the United States, from California to New York, from Washington to Florida. The deer mouse, the primary carrier, is found throughout virtually all of North America, except the southeastern United States, where the cotton rat and rice rat carry different hantavirus strains. Globally, hantavirus infections occur on every inhabited continent. Europe has its own strains carried by bank voles and yellow-necked mice. Asia has strains carried by striped field mice and Norway rats. South America has the Andes virus, which is unique in its ability to spread person to person. Climate change is adding a new dimension to hantavirus risk. Warmer winters and altered precipitation patterns affect rodent population dynamics. El Niño events, which bring increased rainfall to parts of the western United States, have been associated with population booms in deer mice due to increased food availability, which in turn increases the number of infected rodents in proximity to human habitations. Researchers from Johns Hopkins and other institutions have published models suggesting that hantavirus risk may increase in certain regions as climate change alters the ecological conditions that support rodent populations. For pet owners, I want to offer some reassurance. Domestic cats and dogs can occasionally catch and kill infected rodents, but they do not appear to become infected with hantavirus strains that cause human disease, and there are no documented cases of pets transmitting hantavirus to their owners. However, pets that catch rodents can bring dead or dying rodents into the home, creating a potential exposure risk when you handle or clean up after the rodent. If your pet brings you a dead mouse, do not pick it up with bare hands. Use gloves, place it in a sealed bag, and dispose of it in an outdoor trash container. There is one more practical prevention measure I want to emphasize: proper food storage when camping or hiking. If you are spending time in areas where deer mice are present, which includes most campgrounds, backcountry shelters, and mountain cabins in North America, store all food in sealed, hard-sided containers. Do not leave food out overnight. Keep your sleeping area clean and free of crumbs. If staying in a cabin or shelter, inspect for rodent droppings before setting up your sleeping area, and if droppings are present, follow the wet cleaning protocol before spending the night. These simple precautions can prevent the kind of exposure that leads to infection. Finally, I want to highlight the importance of early communication with healthcare providers. If you develop flu-like symptoms within 8 weeks of any activity that might have exposed you to rodent droppings, cleaning a storage area, entering a cabin, working in a barn, hiking in rodent habitat, tell your doctor about the exposure immediately. Do not wait to see if the symptoms improve on their own. Early recognition and supportive care in an intensive care setting can mean the difference between survival and death. Hantavirus is rare, but it is deadly, and the early symptoms look exactly like common illnesses that most people would dismiss. Awareness is your most powerful protection. I should also mention the importance of recognizing hantavirus in children. While hantavirus pulmonary syndrome is most commonly diagnosed in adults, the average age of confirmed cases in the United States is around 38. Children can, and do, become infected. Children who play in barns, garages, woodpiles, or outdoor areas where rodents nest are at risk, and their symptoms may be dismissed as a childhood viral illness more readily than in adults. Parents should be aware that a child who develops sudden high fever, severe muscle aches, and fatigue after playing in rodent-prone areas should be evaluated promptly, and the exposure history should be shared with the paediatrician. There is an important distinction between hantavirus pulmonary syndrome, which occurs primarily in the Americas, and hemorrhagic fever with renal syndrome, which occurs primarily in Europe and Asia. Both are caused by hantaviruses carried by rodents, but they affect different organ systems. Hantavirus pulmonary syndrome primarily attacks the lungs, causing the fluid accumulation and respiratory failure I described earlier. Hemorrhagic fever with renal syndrome primarily attacks the kidneys, causing kidney failure, hemorrhaging, and shock. The fatality rate for hemorrhagic fever with renal syndrome varies widely depending on the strain, from less than 1% for Pumala in Scandinavia to up to 15% for Hantavirus in Asia. Both forms of disease are preventable through the same rodent avoidance and safe cleaning measures. One practical tip that I have not mentioned yet involves maintaining the area around your home. Rodents are attracted to shelter and food sources near human dwellings. Keep grass mowed short within a 30-foot perimeter around your home. Remove wood piles, rock piles, and brush piles that provide rodent nesting sites. Store firewood at least 20 feet from the house and elevate it at least 12 inches off the ground. Trim tree branches that overhang the roof because some rodent species can climb and enter through gaps in the roofline. These landscaping measures reduce the density of rodents near your home and decrease the likelihood of them finding their way inside. I also want to note that the incubation period for hantavirus, the time between exposure and the onset of symptoms, can be as short as 1 week or as long as 8 weeks. with most cases developing symptoms between 2 and 4 weeks after exposure. This long and variable incubation period makes it easy to lose the connection between the exposure event and the illness. If you cleaned out a garage 2 months ago and now have a sudden fever with severe body aches, you might not think to mention the garage cleaning to your doctor, but that connection could be the critical piece of information that leads to the correct diagnosis and life-saving treatment.